Hi, welcome back to my channel. So today I want to talk about rheumatoid arthritis. And before we begin, I want to inform you about the aim of this presentation is to understand the definition, the etiology, the symptoms, the risk factor, the pathophysiology of rheumatoid arthritis, the diagnosis, the intervention, and prevention. So what is the definition of rheumatoid arthritis and what is it about? Rheumatoid arthritis is a systemic autoimmune disorder, triggers inflammation, cartilage bone deformity and infection at joints, small bones including fingers, toes, and knees. Simple way to describe rheumatoid arthritis is the joint inflammation, and it affects the heart, kidney, lung, digestive system, eye, skin, and nervous system as well. But specifically, it's an inflammation at the joint. So any small part in the fingers, toes, knees, elbow, there's joint, that's the inflammation at this area. It can identify as rheumatoid arthritis. And it's a systemic autoimmune disorder, which means it's when the cells command self-attack its own healthy system. So it affects the immune system and it results in inflammation and bone destructions. So rheumatoid arthritis can be characterized by synovial inflammation, again at the synovitis or synovial inflammation, hyperplasia, like when it's swelling, we can observe the signs of swelling as well. Autoantibody production, so like the antibody productions like enzymes or fluids like excessive producing. The anti-citrullinated protein antibody, these only know when we do the diagnosis for rheumatoid arthritis, and also characterized by ACPA, the anti-citrullinated protein antibody. Catalytic bone deformity, so we can observe where bone destruction. Systemic feature like it links to cardiovascular disease, pulmonary, psychology, and skeletal disorder. And because it's a systemic autoimmune, so that means it self-sabotage its own healthy tissues and simply affect the joint and trigger inflammation, response, and swelling. So what are the symptoms of rheumatoid arthritis? We can know the symptoms of rheumatoid arthritis through basically on the joint pain, hyperplasia like swelling at the knees or elbow, tenderness, stiffness in joints, especially in the morning, and symmetry symptoms like when it occurs on both sides of the legs or arm. If one side is affected, that means the other side of the arm also affected. It's symmetry. And the systemic manifestations, like how it can develop from rheumatoid arthritis, include extra-articular manifestations of rheumatoid arthritis, like the C-reactive proteins is so high that indicate severe inflammation, cytokine matrix degrading enzymes due to prolonged genetic inflammation, and we can also observe these through the ACPA test. Cardiovascular disease, also another manifestation of rheumatoid arthritis linked to heart attack, heart failure, or and myocardial infarction, and malignancy, like it developed into cancer. It can be Hodgkin or non-Hodgkin lung cancer, and respiratory disease are also manifestations of rheumatoid arthritis due to pulmonary arthritis and neurological damage. So because of rheumatoid arthritis, it requires severe medication to treat the condition. So it can link to drug toxicity, and then it then result in joint damage or vasculitis, like it got cut or inflammation at the blood vessels, and renal or gastrointestinal tract disease due to inflammatory mediator because of the overproducing of cytokine release, the chemical release, and it leads to anemia, loss of red blood cells, and that will result in erythropoiesis impairment. And these are the systemic manifestation of rheumatoid arthritis. Again, what is the cause of rheumatoid arthritis? Like what causes rheumatoid arthritis? So people will think rheumatoid arthritis is joint inflammation, and it may cause because of the physical activities that affect the joint, like simply at the bone area. But the root cause of rheumatoid arthritis, it develops because of interaction between synoviocytes, the cells in the joint, and interact with the innate immune system, the first line defense. So the cells in the joint, it interact with macrophage cells, neutrophil, dendritic cells, or mast cells, and then it activate adaptive immune system. So like activate the T cell or B lymphocytes. I will go in detail about rheumatoid arthritis. It occurs with a process called citrullination. Citrullination is a process that converts the amino acid adenine protein into amino acid citrulline. The AAAP convert into AAC. So citrullination conversion of AAAP into AAC, it needs one enzyme and one antibody production. So the one enzyme that we need to that citrullination conversion process convert, it's called peptidyl arginine deaminase (PAD), and it's a calcium dependent enzyme that alters proteins function and structures of the bones. Then the other one, antibody production, is a type of protein that's called anti-citrullinated protein antibodies. We call it ACPA. And we also have the ACPA test in the diagnosis for rheumatoid arthritis. So these protein antibodies, it reduces bone density and the citrulline protein level, it reducing the citrulline protein level and bone density, then it's accelerate the joint destruction. So rheumatoid arthritis and pain may occur when the overproducing of anti-citrullinated protein antibodies, or ACPA level is so high in the blood test. So these are the cause of rheumatoid arthritis, and it classified into 4 stages. Stage 1, it triggers. So the root cause is not just citrullination process convert, which means the alteration of proteins production, but it's also because of the environmental triggers in stage 1. And then stage 2, it's maturation. When the genetic susceptible, it become like they infected by those bacteria or viruses. Then stage 3, targeting. When it targets visceral organs like oral, mucosal, lung, mouth, gastrointestinal tracts, and then stage 4, it hyperplastic synovium, so it spreads to the bone, like causing cartilage bone damage, bone erosion, systemic consequences, and swelling. So to recap that, rheumatoid arthritis causes involve environmental factor triggers, the disturbance of peptide citrullination and protein changing, and citrullination process. So what are the risk factors of rheumatoid arthritis? Rheumatoid arthritis, according to Arthritis Foundation, so they inform that rheumatoid arthritis linked to environmental factor, so which means smoke pollutions, contaminated chemicals that infect the immune system, specifically immunocompromised people. So once those chemical or toxic goes into the person's lungs, mouth, and they become like the inflammatory response activate release chemical cells to this called the innate immune defense and adaptive immune response interact with the sineral cells to fight against smoke pollutions or contaminated chemicals. And if the fight win, we is resistant to the smokes, to the pollutions. But if the fight lose, then we got infected by bacterial viruses, and that's when rheumatoid arthritis develop. Smoking and excessive alcohol consumptions also linked to rheumatoid arthritis development. Illicit drug uses, it also affects the joint inflammation too. Those who born with a shared epitopes genes, like genetic material with the HLA-DRB1 genes, usually in females, they born with epitopes genes, so they are more high risk of rheumatoid arthritis development. Also linked to fall risk, accidental injuries or trauma that influencing rheumatoid arthritis. Calcium deficiency and low vitamin D in the diet can also increase the risk of rheumatoid arthritis. Gum disease. Those with oral inhaled the respiratory disease or having bad breath, they tend to have poor immune system. So that's when the bacteria can invade into their immune system, and that's when they develop into gum disease. And prolong having those oral disease, it will then contribute to rheumatoid arthritis development. Post-menopause osteoporosis, usually for female who are ending their menstrual cycle in the late adulthood or early adulthood. That's when the osteoporosis are high risk of developing, and they're linked to rheumatoid arthritis as comorbidity. Autoimmune to pathogens, again, it's a systemic autoimmune disorder. So rheumatoid arthritis is when the cells attacking its own system. And then prolonged side effect from medication like hypothyroidism, like low gradually weight loss and causing low bone densities from the side effect. And if the side effect is severe, that causing bone loss, then a prolonged side effect can link to rheumatoid arthritis too. Nutrition, those who is obesity, also high risk of rheumatoid arthritis development, and prolonged physical inactivity. For this case, prolonged physical inactivity also just part of the risk factor, but over-laborize, like overworking, like over-labor the workforce, can also increasing the risk of rheumatoid arthritis. when we use physical bodies to perform heavy tasks and for many like prolonged times, it also linked to rheumatoid arthritis, causing inflammation to the joint. Age factor of deterioration, it's inevitable, and giving birth at older age also linked to rheumatoid arthritis. What is the pathophysiology of rheumatoid arthritis? The pathophysiology of rheumatoid arthritis, I'm just going to read these because it's really important. So it lies in the environmental triggers from smoke pollutions and industrial pollutions like silica crystals that affects the person's intestine, lungs, oral microbiota, and then develop infection because of the bacteria and viruses invasion. So once the persons inhale the smoke pollutions from the industrial like silica crystal, then it goes into the lung, the oral, the intestine, and then it develop infection because if those pollutions contains bacteria and viruses, and then these environmental trigger will then triggers genetically attack the susceptible individual with who is immunocompromised or where the portal entry of them like through the mouth, oral, where inhalation, where the eyes, blood, lungs, etc. And then it affects autoimmunity epithelia of the person's gastrointestinal tract. It affects the tissues of the gastrointestinal tract, causing severe infection. And that's when people tend to have gum disease or bad breath. The citrullination of PAD and ACPA. So this case, as mentioned in the previous, the PAD is the peptidyl arginine deaminase enzymes, and the ACPA, which is the anti-citrullinated protein antibodies. So the citrullination process, it converts through these two processes, and then it attacks the person's genes. So it converts the amino acids and then attacks the person's gene genetic material, then develop into synovitis or synovial inflammation, joint inflammation. And that disturbance of the peptide citrullination activate the APC, known as antigen presenting cells in the immune system. So it activates that antigen presenting cells and the fibroblast-like synoviocytes, the FLS. So it activates these two cells, then triggers the release of dendritic cells and macrophages. So dendritic cells and macrophages like humoral B cell and T cell of the adaptive immune system. Then when it's interact between the cells at the joint in the joint area, bone area, it interact with the adaptive immune systems, the cell in the adaptive immune system releasing. Then it's overproducing antibodies. And when it overproduces the antibodies, it ingests its own healthy cells. So when it ingests its own healthy cell, it means autoimmune disorder occur. So that's when the pathophysiology of rheumatoid arthritis develop. So what are the diagnoses of rheumatoid arthritis? The diagnosis of rheumatoid arthritis includes blood test, rheumatoid factor test, and ACPA test. So blood test, we observe the C-reactive protein to observe inflammation that produced in the body and liver. It indicates systemic inflammation in a rheumatoid arthritis patient, and the normal range should be less than 5. And then we also observe complete blood count, the full blood count, to observe hemoglobin, red blood cell, white blood cells, platelet, immune system, to ensure there's no any sign of anemia. And erythrocyte sedimentation rate, the ESR, also observed in the blood test to check the inflammation rate and how fast or slow that the red blood cell and sign of anemia can trigger. And the normal range should be less than 12. Rheumatoid factor test, the RF, is to observe the autoantibody levels that can detect inflammation and intensity of rheumatoid arthritis. It's really important. And the rheumatoid factor should be less than 20 units per milliliter. And again, antibody found in the human blood is about 70% or 80% of people with rheumatoid arthritis, and then it can elevate up to chronic infection and autoimmune disease. So then the ACPA test is known as the anti-citrullinated protein antibodies test, or we call it another way, call it an anti-CCP. Anti-CCP, the full word is anti-cyclic citrullinated peptide test. It's another antibody test to observe the level of amino acids, citrullinated level in the blood. The same as rheumatoid factor, to the normal range of ACPA test or anti-CCP should be less than 20 units per milliliter. We also have radiography for diagnosis of rheumatoid arthritis, but X-ray for if X-ray of bilateral hands, it's not very conclusive for all rheumatoid arthritis, but ultrasound will show diffuse bilateral synovitis of the metacarpophalangeal joints. So the wrist, the proximal, and the interphalangeal, PIP joints. So ultrasound, CT scan, bone scans are recommended to check the rheumatoid arthritis. Then let's move on to intervention. There are medications, include DMARDs. DMARDs stand for disease-modifying anti-rheumatic drugs. So disease-modifying anti-rheumatic drugs, it reduces damages to the joint, skins, and tissue. However, it is not a painkiller, so it's not an analgesic medication. DMARDs drugs classify into three types: conventional synthetic DMARDs, CS-DMARDs. It's for rheumatoid arthritis. So like common example would be methotrexate or hydroxychloroquine and sulfasalazine. But the second types of DMARD is called targeted synthetic DMARDs. So it targets the cells. And biological DMARDs or BDMARDs, it's the third types of DMARDs medications. These are not painkiller. These just to reduce or inhibit the damage to the joint, skin, and tissues. Next medication types is NSAID drugs. NSAID stand for non-steroidal anti-inflammatory drugs. It's a drug that activates the COX receptor binding to the nerves, brain, and spinal cord to reduce inflammation, where anti-inflammatory chemical protein releases. So it can reduce the pain and rheumatoid arthritis because it reduces the pain and inflammation of the joint. So NSAID drug is one of the medication for rheumatoid arthritis. And then corticosteroid is also treat rheumatoid arthritis for those with severe conditions. And corticosteroid usually administer with injections and to decrease the pain, irritation, and treat severe rheumatoid arthritis to suppress immune system against its hyperactive response. Also, there are other non-pharmacological interventions that not need the medication to treat rheumatoid arthritis, including patient resting, weightlifting reduction, follow the occupational therapy to review for exercise, stress alleviation. In this case, the nurse may use TENS electrical device. It's called transcutaneous electrical nerve stimulation. It will reduce the pain and stimulate the nerves. It's basically relaxation therapies. And overprotection of joint activity or physical exercise can cause intense inflammation. Instead of that, developing the care plan activity to reduce joint stress. And surgery may be required if it's severe or joints or physical cannot move. Arthritis Australia informed that different types of surgeries for rheumatoid arthritis include arthrodesis. It's choosing joint when joint are no longer movable. So example like ankle, wrist, thumbs, fingers. And arthroscopy is another surgical procedure like incision keyhole to capture the image, usually done for osteoarthritis needs patients. And arthroplasty or joint replacement is to remove the joints and replace with a new plastic or ceramic parts. Osteotomy joint alignment procedure, usually for hips area. Resection, removing the bones and the entire joints. And synovectomy is remove the synovium joint lining and then regrow that joint later on, usually several years after the surgical procedure. However, symptoms may come back. So I want to explain detail about these three parts of the fingers that affect by rheumatoid arthritis. So in the joint fingers, we can observe through three stages. We call it three spot area as seen in the presentation. So the first next to the nail part, it's called the DIP, which called the distal interphalangeal joints. And then the middle part is called PIP. It's called proximal interphalangeal joints. And then the third next to the arms, hands, it's called metacarpophalangeal joints. So MCP, PIP, and DIP. So I explain this because the rheumatoid arthritis, it's an autoimmune disease. It attacks the joint because of the infection from the environment that can cause inflammations. And that's when it affects the MCP and PIP joints. So rheumatoid arthritis will commonly affect the proximal interphalangeal joint, PIP, the middle part of the fingers, and the MCP, the end part. It's called metacarpophalangeal joints. So it commonly affects only these two parts, not the DIP, just PIP and MCP. And I want to compare these because it's so similar and causing confusion. Rheumatoid arthritis versus osteoarthritis. So osteoarthritis is due to the injuries affecting the joint, causing loss of bone cartilage. And then it has a progressive symptoms of bone loss, and it affected the joint with grinding noise and popping noise. osteoarthritis will trigger the DIP part, which is the distal interphalangeal joint. But the rheumatoid arthritis, it triggers the MCP and PAP parts, the proximal and the metacarpal. So rheumatoid arthritis trigger PAP and MCP, and osteoarthritis trigger the DIP part. And conversely, for rheumatoid arthritis, it's an autoimmune disease. It attacks joint because of the infection from the environment, causing inflammation to the joint. And the symptom of rheumatoid arthritis, it can flare and ease, and then develop into fever, fatigue, or rash because it's systemic. And it needs the DMARDs and NSAIDs and corticosteroid for pharmacological intervention to treat rheumatoid arthritis. And the joint stiffness of rheumatoid arthritis may take more than 30 minutes. While the osteoarthritis is just the cause of injuries that link to bone loss, then develop into inflammation to develop into joint grinding noise and popping noise, like loss of bones. But there is no inflammation much, and analgesic medication may treat osteoarthritis, and the bone stiffness is less than 30 minutes. So comparing between osteoarthritis and rheumatoid arthritis, the osteoarthritis may persist in symptom less than 30 minutes, which is quicker than rheumatoid arthritis has prolonged pain or prolonged joint stiffness, and it can cost like more than 30 minutes. So again, to recap these, so the differences is that the osteoarthritis is less severe than rheumatoid arthritis in terms of symptoms progression and pain duration. It affects specific location of the joint. However, the rheumatoid arthritis symptoms, it will take longer to heal, and it can flare or recurrent due to multiple joints that may affect it. Because rheumatoid arthritis, it's not just affected one joint specific location, it affected multiple places of the body. Like if it's symmetric symptoms, so if the person's got inflammation to their fingers at the right arms, then the left arm may also affect. If the inflammation at the right knee is affected by rheumatoid arthritis, then the left knee also affected. It will then develop. It's not just invisible spreading, but it's symmetry symptoms, and it's systemic. So in this case, it affects because it's an autoimmune disease, then it triggers immune system, it activates anti-inflammatory response. So as seen in the pictures, the comparisons. So osteoarthritis because of the injuries or overuse of physical labors, while rheumatoid arthritis because of the immune system attacking the joints. And why it attacks the joint? Because of the environmental triggers. And osteoarthritis causing bone loss, while rheumatoid arthritis causing inflammation. The symptom of osteoarthritis can be progressed. It takes time to develop, while rheumatoid arthritis, it just flare, it's just happening immediately. And osteoarthritis affect joint, grating noise, or it can pain sign can be seen. But rheumatoid arthritis, it's systemic. It just develop into fever, fatigue, or rash, skin rash, or swelling. And medication for osteoarthritis, it just analgesic medication, just normal medication, normal pain medication, like for example, paracetamol or morphine. And rheumatoid arthritis, it needs the specific medication like the DMARDs medication, corticosteroid, and NSAID drugs. Bone stiffness for osteoarthritis is less than 30 minutes, while joint stiffness for rheumatoid arthritis is more than 30 minutes. And osteoarthritis affects the DIP joint, but rheumatoid arthritis affects the MCP and PIP joint. So what are the preventions of rheumatoid arthritis? Simply resting and keeping comfort posture. When you walk, stand, sit, the philosophy of living and activity, keep it in a comfort position and stable, balancing your physical body and resting. However, not like over bed resting. Weightlifting reduction. So the person who already feel inflammation feel swelling, pain at their joint should reduce weightlifting. Physical massage to improve blood flow. Sufficient vitamin D and calcium intake in the diet also improve bone strength. Reduce high-fat red meats, salt intake, and replace those with steamed soybean, green vegetable, and milk that it can strengthen the bones. Avoid smoke pollutions or industrial pollutions, toxic or contaminated inhalation. So simply wear mask and avoid those inhaled smoke. Basically, if we work in the environment that is really toxic, wearing mask because prolonged inhale of those toxic can then triggers the immune system, then it links to rheumatoid arthritis development. Bone collagen supplement for women ending menstrual cycle. It helps to prevent or reduce bone, prevent the reduction of bone density loss. Stop smoking and alcohol. Prevent fall risk or accident, usually from the environmental awareness. So consider the shoe types and non-slippery shoes, good lighting, not wet floor, with precaution. So avoiding fall risk. Maintain oral healthy, which means brushing teeth is really important. Having consumed food that did not cause gastric discomfort. So oral healthy is really important because gum disease linked to rheumatoid arthritis development easily. And then stay hydration and consult with occupational therapy or physiotherapists to check the signs and symptoms, and physio exercise for more detail about rheumatoid arthritis prevention. So this is really important. If you watch this video, please give awareness to spread awareness and to your colleague or your friends or who are significant others to understand the risk factor of rheumatoid arthritis development. It can occur to many all types of people in all lifespans. So thank you for watching Professor Verbal upon request, and please give a like or subscribe to my channel if you want to know more about health topic related. And thank you.